This is Maritess.
This is Parker.
And this is Laura. Welcome to MedSurg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud MedSurg nurses just like you,
sharing our stories, insights, and experiences to support you in your nursing journey.
We're very happy to have back with us as guest host for this episode, Samantha MacMillan. Welcome back, Samantha.
Thank you so much for having me. I haven't been with you guys since this summer, and a lot has been going on. I've been listening in, seeing what you guys have been up to, and really happy to be back.
Good. We're happy to have you. Our topic today is going to be on Mediports, but as always, we're going to get started catching up with each other. We are now into the brand new year. It's now 2024. I thought we'd take a minute and kind of talk about what kind of New Year's resolutions or plans or goals that we've made throughout the year. Samantha, why don't you get us started?
When I last left off, I was studying for my nursing professional development certification. So got that taken and passed, which was super exciting. And then soon after that, I found out that my husband and I are expecting our first baby, which is also very exciting. And then the biggest thing that's been happening in my world these days at work is that I was able to be the nursing lead for the implementation of new IV pumps throughout our entire organization. So led the way of getting about 1,000 people trained in about a 2-week time frame for some new IV pumps that rolled out last week. And it's gone really, really well. We've been super excited about it. Our old pumps had been end of life for probably at least 5 years now, but we all know what COVID did to all of our timelines. So that's what's been kind of going on with me personally, thinking about goals and things for 2024. This is like the first time in my life I felt like I'm going to kind of pump the brakes a little bit on professional development and be focusing on my family life, things like that with maternity leave and things coming up. But super stoked to have gotten that certification in 2023, and things have been really steady in my role at work. So I might cruise through 2024 this year and then see what it has to offer for me. Maritess, what are your plans for 2024?
First of all, I am very happy. Congratulations. Such great achievements. I'm very happy and excited about the new baby. I don't know if you know, but I have 5 kids. I wish I could have more, but also obtaining your NPD certification. That's one of the most difficult examinations. So congratulations.
Thank you so much.
Well, for me, my goals, 2023 has been really very busy. It has been a lot of activities, a lot of volunteer work. I was adding up all my volunteer hours and a lot of things, but I really enjoyed every single moment that I'm spending with people. For 2024, my major goal is really to connect with family, to really enjoy travel time, memories with the family. I think I did that in 2023, but this year it will be more of reconnecting with other family members I haven't seen for a long time, haven't reconnected for a long time. Life is short. I've lost family members in 2023. And so really reconnecting with them, especially those who are aging, I think it's really important, especially for my kids. How about you, Parker? Anything new, and also your goals for 2024?
Hey guys, I haven't been on for quite some time, so I feel like we have a lot to catch up on, but I'm just going to mention a few things. I guess I'll go back as far as September. So in September, I went to go see Beyonce, which was super cool. Went to go see her in Los Angeles, had a VIP tickets, like definitely one of the highlights of my late summer. I've just been working, hanging out, trying to refocus for school. I start school again in January, pursuing my acute care nurse practitioner degree at Duke University, so I can't wait until that's over. I'm looking forward to just trying to get on the right foot for school. I kind of recycle my goals every year, but definitely getting in shape is at the top of my list. So just trying to hit the gym 3-4 times a week, honing in, I guess, on school. It's probably going to take up a lot of my time. So I think those are my goals for the next coming year, and also always traveling, eating well, things of that nature, but probably just fitness and school are at the top of my list. I am looking forward to the new year, even though it'll be a challenging year. So Laura, what's going on with you?
So I've been doing the same and thinking about what I want to accomplish both personally and professionally this year. I finally feel, a year and a half later that I am more comfortable in my new role as an NPD at my current position. So I'm ready to start moving forward. So I think I've mentioned on here before that I'm starting my DNP journey in January, coming up here in a couple of weeks. And I'm incredibly nervous and very, very scared about how it's going to impact my time with my family and with work. But I am very, very, very excited to get started on that. I've been putting it off for quite some time. And personally, I think I am going to focus on family, just like you guys. I have made one goal in particular along with my daughter. We are what people affectionately call book dragons, meaning we buy a lot of books, but we don't necessarily read all of the books that we have. So we've kind of made a goal to pick 6 books for the year. And we're going to meet up every other month and kind of hold each other accountable to read one of those 6 books. So hopefully by the end of the year, we're going to be able to have made a dent in some of these TBR books on our list. So I'm really excited about that. We both came up with that together to hold each other accountable, and something that'll make us get together and talk about other things other than school and life that gets in the way. So I'm excited to share that with her. And we'll see how that goes for the whole year. So why don't we go ahead and move on to our topic? Today's topic is Mediports. And since it's my topic, I thought I'd give you some background about why I chose this topic. I started as a medical oncology nurse. Mediports have kind of been in my space since I started as a nurse. So outside of when I first started, I've never been afraid of them. I've always been very comfortable with them. But I am noticing as an educator now that one of the things I get asked most often is to train nurses on how to access Mediports. So I thought that might be a really important clinical topic for med-surg nurses to be aware of, just a few things about them and why they're not so scary. If you don't see them very often, it can be very daunting because there's a few extra steps, there's different pieces of equipment that you might use, but there's not any reason to be afraid of them. Has anybody else had any thoughts or experiences around accessing Mediports?
I kind of have oversight of our entire med-surg service line with one of my other colleagues, and the departments who don't take care of the oncology patients very often are running into circumstances where the port needs to be accessed or de-accessed, but they can't find anybody who's actually certified to do so, and then they want to get trained. But where I'm always a little bit nervous is that I'm worried that they're not going to see it enough to maintain their competency in accessing the ports. So we've been kind of working on rethinking our processes and structures around ports and making sure that the nurses have access to the folks who are certified that can easily meet the needs of those patients without delaying cares or anything like that. So yeah, it's a very timely topic.
My experience with Mediports, we have an IV access team that accesses the Mediports for us. So typically when a patient comes into the emergency department and they know their history and they have a Mediport, there's an IV access team down there that will access the Mediport for us before they come up. So I've actually never accessed one. I think one of the issues that I run into as a night nurse is not having the IV access team there at night. So unfortunately, especially if someone's a difficult stick or chronically ill, we have to get a peripheral IV access instead of accessing the Mediport just for the night. The hospital I work for, even though I'm technically a travel nurse, I've petitioned them to, hey, we need an IV access team at night. I don't see them often at the new hospital I work for, but at one of the first hospitals I worked for, we used to get them all the time. And that hospital fortunately had a 24-hour IV nurse who would be able to come in and access the Mediport for us. I think that it's super important, even when we don't see them often or if you are unable to access them, to be able to care for them like you would a central line, as far as the dressing changes, covering your ports, make sure that your tubing is changed every 24 hours or however your policy is at your hospital.
For my experience when I was still working at the bedside, like Laura, I'm very comfortable with accessing ports. One of the reasons why I was comfortable was because I was trained by one of our vendors, actually, who helped. I was on part really of the PIC team or our IV team, but our director made it a point that everybody is familiar and trained to access port because we've been getting a lot of patients. And then eventually, at some point, our CNO decided to put together a dedicated team that's primarily accessing the ports. But one of the reasons why I really feel confident and comfortable was the training. And then we had refresher training every now and then. So that was one of the key factors or something that we really wanted to share to our listeners. Find your resources. And if you wanted to access and to have the training, reach out to your leadership team, just like what you mentioned, Parker. I think it's so important that you voice that out. Maybe that's not their focus right now. Mediports are oftentimes confused with PIC lines. Again, it's education and familiarity. When I became an educator, that's always part of our competency checklist, like what Samantha mentioned a while back, making sure each nurse is competent, because it's true, they probably won't see the ports very often. And so how do you really keep up and maintain those competencies?
Great points, Maritess. PIC lines, central lines, there's all kinds of lines that we use for our patients, but I just wanted to focus on Mediports today because to me, I feel like we have had many instances of care being delayed while we waited and rushed around or made a plan to find someone that was trained to come in and access the Mediport. And Mediports are well within our scope of practice as a med-surg nurse. So I just wanted to cover a couple of things about things you can do to help yourself become more comfortable with accessing a PIC line. The training is obviously very, very important. So if you can get yourself trained. And like Samantha says, it is difficult to maintain your competency, especially if you don't see them very often. But if you can seek out those opportunities and you do it a couple of times, I guarantee you will get more comfortable, you will be less afraid, and you will be more prepared to step in and help your team if that comes around. So the first thing I want to talk about is palpation. Ports can be in a couple of different places, but typically you're going to find them on the chest. And the first thing you always want to do, of course, after you do hand hygiene, is put your hands on your patient's port. Feel around and figure out where it is, what kind of port it is. And while you're doing that, talk to your patients. Your patients probably know a lot about their port. They can probably tell you what kind of needle to access with, how long the needle is. They can probably tell you about what other nurses have done. They can tell you if they've had issues with their ports a lot. So that conversation is very, very important before you even gather any equipment. So just kind of familiarize yourself with what's going on with your patient. The next thing you want to do is gather your supplies because this is and should be a sterile procedure. This is a central line, just like a triple lumen, just like a Grashong, just like a PIC line. We have to give it the respect that it deserves. So you want to maintain your sterility at all times. I would recommend you bring a friend with you before you do it, just to help you maintain your sterility, because when you are by yourself and something happens while you're doing your access, if something falls off that sterile field, I think everybody can say it with me. Yes, we are tempted to cross that sterile field. So bring a friend with you to help you stay sterile. The other thing you want to talk to your patient about is whether or not this is a power port or a regular Mediport, because that really does make a difference. I think now most patients are getting power ports, but you may still see some of those other ports that are out there that are not power ports. So if you have a power port, you have to access it with a power port needle. If you don't access it with a power port needle, then it won't be prepared to handle any contrast if your patient needs to go for contrast. So those are questions that you want to ask your patients. They should know the answers to those questions, but if they don't, you have to search for documentation. So whether that is a card that they carry, sometimes they have a bracelet, but a lot of times you can look at old scans, you can look at old opera ports, but you want to verify whether or not that port is a power port before you access it with that power needle. Anybody else had any issues with that?
No, but I love what you were saying about bringing a friend to come do this access of a port. I often teach the nurse residents. We do these little skill stations with them, and we cover central line dressing changes. So kind of along the same lines with our ports here. And I always tell them, it probably took me personally, probably a solid year and a half to feel really comfortable maintaining my sterile field and completing my dressing change and maintaining my sterile technique. without having another person there. So I really love that you said that. I think that can go such a long way for all sorts of different skills, especially when we're needing to maintain sterility.
Yeah. And like we said, especially if you're not fully comfortable with the process, you know the steps, you know what you're going to do, but it always helps to have somebody in there with you to help you talk through it, to help you stay sterile, just for that little confidence boost to have somebody with you. So there are a couple different size needles that you can access patients with. And I always use this tip when I'm doing my training. It comes about when you're palpating your patient, like I was talking about earlier. If that port is sticking out from the patient's chest and you can see it without even having to palpate, you need a very short needle. But if that port is a little deeper in your patient, if there's a lot of tissue or a lot of flesh and you have to press down a little ways, you're going to need a little bit longer needle. So always remember that if you don't have the right size needle, you're going to have issues accessing that port, because you want to be able to get through the port and have that needle sit in the well before you flush any fluids in and out. I have seen the effects of a Mediport that was not accessed correctly, and it was not good. I remember walking in, somebody was saying that they were having issues with the Mediport not drawing, and then they couldn't flush it. So they called me because I was always comfortable with them, and I went to the unit and I undraped the patient, and there was fluid all around the port. It was obviously not being infused into the port. It was going into the patient's tissues. So we immediately got that deaccessed and got aligned somewhere else on that patient. So not only is it important to access it appropriately, but it's important to assess appropriately. You should always take a look at the site itself. Don't just grab that tube and think that everything is okay. You actually have to go in and assess the skin, just like you would a central line, just like you would a peripheral line. You have to go in and make sure that that port is working appropriately. The other thing that's important is blood return. I don't want anybody to flush anything through a port if you don't have proper blood return. I live in the oncology world, so for us, when we're giving chemo, that's step number one. Always make sure that you get blood return before you infuse chemo. But even if you're accessing your port to just give them fluids or antibiotics, it's still important to get blood return. If you get blood return, then you know that your port is accessed appropriately and it's working well. So please, 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 if you take anything away from this podcast, is always remember to check for blood return. Now, that being said, there are some ports that don't draw, but I want you to ask questions before you infuse anything through that port that doesn't draw. Make sure that there's physician documentation or provider documentation. Cover yourself. Make sure that you ask all the right questions and that everything is documented appropriately before you go running fluids through that port that doesn't draw.
Laura, you covered a lot of great points. I like the fact that we mentioned infection, we mentioned about hand washing, we mentioned about flushing the port. I think those are little things, but a lot of consequences may happen. I wanted to add also the fact that we also need to watch out for symptoms of air embolism. If a patient is starting to have shortness of breath or chest pain, do your proper assessment. This may probably be a sign of air embolism, not saying that right away that's what's going to happen, but know that your patient has a port. So notify your doctor, let your doctor know that these are signs and symptoms that are happening and be cognizant of these symptoms.
I agree. I think another thing I would like to talk about is the dressing change process. For Mediports, I know it's a lot different than PICC line. I don't know about you guys, but for our PICC lines, we use transparent dressing, but it also has some form of an antimicrobial patch for that. I have yet to see, and I don't know if it's because I haven't seen a lot of Mediports recently, but I've yet to see a Mediport dressing that has the antimicrobial patch. You do the same steps as you would for PICC line dressing, but it's just like a completely transparent patch with no form of like antimicrobial present.
At my organization, we have dressings for ports that have like a separate piece of CHG, like that chlorhexidine gluconate. I would call it goop, but the little gel pad. And it's interesting for the ports because it's like a completely separate piece within the dressing change kit. So they can put that on and then put the transparent on top. And we still do have kind of the more old school little bio patches, like that little round circular one. If the patient happens to have an allergy to CHG, we still have that available, but it's not our preferred because you can't see through it. So if there is kind of some drainage or redness around the insertion site, we wouldn't be able to catch it until that dressing was changed. So CHG is definitely our preferred antimicrobial for our central lines of ports or whatever kind of central line the patient has going on.
Gotcha. So I guess for our listeners, it would be important to make sure if you haven't seen a Mediport in a long time, just know what resources and supplies are available to you. Ask the charge nurse, because you definitely want to be compliant with how you change your dressing and prevent infection at the site of the port.
Those are great points, Parker. One thing I also wanted to mention is that your schedule might be a little bit different for your Mediports than for your regular central lines. I know at my facility, we have 2 days of the week where we're changing dressings just to make sure that they all get changed. But for Mediports, that needle has to be changed every 7 days. So if it doesn't fall on a day when your dressings are not due to change, if it's been 7 days, you still should change that needle. Deaccess the port and reaccess with a new needle every 7 days. So that might be a little bit different from your regular central line dressing schedule.
Laura, has your organization had really good success with having set days for central line dressing changes? Ours here is just kind of a rolling every 7 days, just based on when the line was placed or the last time the dressing was changed. And CLABSIs have been on the mind and things that we've been talking about fairly regularly and trying to, think about how we can improve our CLABSI prevention bundle. But that hasn't really kind of come up as a topic yet. But do you feel like your organization has good compliance with that?
I think we do. I know when this first rolled out, like I said, I've been a nurse for a while, and this has been a part of our schedule for a long time. So it used to be one particular day a week. Like I think at one facility it was every Sunday, and one facility it was every Wednesday. But we always taught it to be it's every Sunday or every Wednesday and PRN. So if you have another situation that pops up where you feel like you need to change the dressing, you can always change it early. Let's say your dressing change day is Wednesday and you have to change your dressing on Sunday because it was leaking or whatever. You still change the dressing again on Wednesday. So it may lead to more frequent changes, but that way we could all do our audits. Because we also changed the different caps on the end. So the caps were either red or they were green, depending on whether it was an odd week or an even week. So when somebody was doing audits, if they saw the correct color of caps, then they knew that the dressing had been changed.
Oh, that's really interesting. I might have to take that one back.
I think it's worked really well. Now, what does throw things for the loop is the Mediports, because the Mediport needles have to be changed every 7 days regardless. And you don't want to stick your patient with a needle more often than you need to. Because the other thing to remember is that every time we access that port with the needle, that we're increasing the opportunity for infection. That's why I said earlier that changing their Mediports might be a little bit different than the way you do your central line dressing changes, simply because you have to change that Mediport needle every 7 days.
So kind of along the same lines of bringing in a friend to make sure you're maintaining your sterility, I think it's also important to remember we were talking about some of these operational issues of maybe not having enough resources, especially on night shift, to access ports, things like that. But I'm always trying to hit home with new nurses at my organization. Like, you have to think about people working in other departments. We all have kind of different specialties within MedSurg as a specialty of its own. And so thinking about where would a port certified nurse be working right now? There was a patient who ended up having kind of a late evening discharge that was delayed because nobody on the floor at that time was port certified, and it was an ortho neurosurgical floor. So it wouldn't be common for one to be there anyway. But I asked them, did you guys call the oncology floor? And they didn't even think to do that. So I think we've still just been so used to working in our silos and in survival mode coming out of COVID still, but trying to think about where else in the hospital could I find somebody that can help me access or de-access this port.
It's a good point. I can tell you, as an oncology nurse, it was sometimes annoying for other floors to call us to come and access their ports. It's sometimes hard to get away from your floor to go to a totally different floor and do what in your mind is a fairly simple procedure. So I always try to tell people to give everybody some grace. Ports can be kind of scary if you don't know what you're doing. So I want to challenge all of our listeners to try not to be afraid of these ports. If you do it once and you really find that you like it, then maybe advocate for some more training for your facility. There's no reason that MedSurg nurses can't be rock stars at accessing ports. Believe it or not, we're just about out of time. So before we go, let's quickly summarize what we've learned. While there are specialists who focus on Mediports, Mediports are well within our scope of practice as MedSurg nurses. Training and refresher training is very important for med-surg nurses, so reach out to your resources and your leadership. Like Samantha says, your oncology nurses are whizzes at this. After hand sanitation, always remember to locate and palpate your port and talk to your patient first before you go get any equipment, just so you are aware of where in the body that port is, how deep it is, so you know what kind of supplies you're going to need. Familiarize yourself with what's going on with the patient, and also find out what your patient can share with you. They might be able to give you some tips. Maintain your sterility at all times. And remember to bring your buddy, bring a friend with you to the bedside to help you stay sterile. Be sure that you're asking about whether or not that port is a power port and whether you need to access it with a power port needle, especially if there's a chance that they might need contrast. If your patients don't know the answers to the questions, I guarantee you it is somewhere in the documentation, but you might have to dig a little bit. You can talk to the provider, you can look at op notes, you can look at scans. That information is out there. And if you don't find that information, then be sure that that's documented as well. Always assess the site and the skin before you do anything with that line. Every morning, it should be a part of your regular head-to-toe assessment that you are taking an eyeball to that site and know what's going on there. Always make sure that you have blood return before you put anything through that line. Always make sure that you are checking for blood return. Be sure to check your hospital policies regarding your Mediports, because there's some different ways out there that you can manage your Mediports, from how often you're doing your dressing changes to how you are preventing infection. There's different ways to do that. There's CHG discs, there's antimicrobial discs, there are antimicrobial caps that you can use. So just depending on what is going on in your facility, you want to be familiar with what supplies are ready for you. Thanks everyone for joining us. We'll see you next time. We look forward to connecting with you on the next episode of MedSurg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official MedSurg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org.
I'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the MedSurg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend MedSurg Moments wherever you get your podcasts to help us reach even more listeners.
I invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages. And don't forget to add hashtag MedSurg Moments to your post. Simply enter AMSN in the search field on any of these social media platforms to connect with us.
The content within the MedSurg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Laura.
I'm Maritess.
And this is Parker. And always remember, MedSurg Moments is a moment in our lives, a moment in our MedSurg careers that makes a huge difference.